Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
So these last, 2 years now, I guess it's been, it's all kind of blurs together, but it's been very wild, very a big strain on our system and on our whole community as well. And a lot of us kind of had to hunker down and focus on just the basic day-to-day things. And for a lot of people, healthcare, even primary care, preventative services kind of got put to the back burner. At this point, though, I think we're very fortunate in that we have COVID in a pretty manageable situation for the time being, certainly with great thanks to our community with the vaccination efforts and mitigation strategies. So as we've sort of hit a lull between potential waves of COVID, this is a really great opportunity to sort of rekindle those relationships with your primary care doctor and seek out those important, those vital primary care services that help keep people happy, healthy, and safe. We as primary care doctors, we're not so much specialists in one single disease. We are really a specialist for an individual. And to be good at that, we have to get to know you. And the Well Adult Physical Preventive Care Visit is, again, that head-to-toe encounter where we get to look at the totality of your health and the world that you live in. Our patients are so much more interesting than what we see on a computer screen. And so to actually look one-on-one and talk about where you come from, what you like to do with your time, what's your family like, what are your goals, what are your fears, what's the name of your pets. All these are things that are actually very important to helping us understand you so that we can care for you in a holistic manner. So with a good wellness visit, I think of it as also an opportunity to sort of peek under the hood. There may be things that are going on that don't necessarily have symptoms or that a person can't feel or see day to day. But if they are left unchecked over a period of time, things like high blood pressure, diabetes, obesity, high cholesterol can really accumulate and progress to lead to heart disease, which for the general population is the thing that causes the most problems. And so if we can have the feelers out early and identify and recognize these issues, we can provide some very straightforward interventions and help you, again, find health. With a Well Adult Physical or Preventative Care Visit, there's 4 major factors that can really make a difference in your life, and that includes a cardiovascular risk assessment, a review of pertinent immunizations, and an assessment of relevant cancer screenings. Did you know that colonoscopies we now start at age 45, for example? And then finally looking at sort of the psychosocial health model of medicine. There are a lot of peripheral aspects that we can really help out with. So today's the day to reach out to your primary care team to rekindle that relationship and get back in for a wellness visit, preventative care visit. If you don't have a primary care team, I encourage you to reach out to our healthcare coordination services, 865-305-6970. You can call us from 8 a.m. to 5 p.m. As well, we've got a website, utmedicalcenter.org. So come check us out, make a call, get it in, and let's help you find health.